Now, Frederick Dra was one of the first people who tested positive for COVID-19 in Ghana. A few days later, he was picked up by health officials to the Ghana East Municipal Hospital for treatment. Immediately, his status became public. His life and that of his family changed. His neighbors refused to speak to the family, and food vendors in his area stopped selling food to his family while pointing fingers at them. But Frederick and his family are just one of many who are experiencing stigma because he tested positive for COVID-19. We're told of cases where families in some areas have to deal with neighbors who have refused to speak with them because a family member has been tested positive, where people at work gossip about their colleague who was tested positive, where service providers are refusing to offer services because they've been told a family member has the disease. All are instances of stigmatization. But we keep forgetting something. This disease can strike anybody because nobody is immune, whether you're rich, poor, black, white, young, or old. But while we are at it, let's remember that people who have COVID-19 who are being treated or have recovered are friends, family, colleagues, and neighbors. So let's be careful how we treat them now, because history will judge us. Now, stigmatizing anyone during a pandemic poses a threat to everyone. Research from HIV, Ebola, and other infectious diseases epidemics shows that stigma undermines efforts at testing and treating diseases. People who worry that they will be socially shunned if they are sick are less likely to get tested for a disease or seek treatment if they experience symptoms. And that's a great danger to all of us. Now, stigma, it comes in many forms: gossip, rejection, as well as denial of services, and this can have a negative impact on the mental and physical health of people with the virus. Now, Frederick tells us of his friend who was scared to get medical help for fear of stigmatization after he experienced some symptoms. And I'm sure you watching me at one point or the other have ignored a symptom and not sought medical help because of fear of stigmatization. Now, the impact of stigmatization can be worrying, as it may lead to people ending their lives by way of committing suicide just to escape being shamed or pointed at for having contracted or recovered from COVID-19. Now, often people who shun others for reasons like this do so out of fear or ignorance of the status of the recovered person, whether they are in their recuperated state can affect people or not. Now, the truth is, once the person is treated and cured, he or she is normal as everybody, and indeed has no infection to transmit. Before the thought of shunning someone because he or she has recovered from COVID-19 comes to you, ask yourself, how would you want to be treated should you suffer the same fate? Remember, COVID has infected prime ministers, their spouses, ministers, celebrities, and a lot of people across the social spectrum. The good book tells us to do to others as we would have them do to us. Imagine you fully recover from an ailment and nobody, even within your immediate circles, want to have anything to do with you. How would you feel? Now, this is how people feel when we shun them, and it can have crippling effect on their self-esteem and mental health. We need to fight the stigma the same way we are fighting the virus. So, how do we help avoid stigma around coronavirus? I'll leave you with some tips from the World Health Organization. Now, we need to, 1, maintain privacy and confidentiality of those seeking health care and those who may be part of any contact investigation. We also need to raise awareness about COVID-19 without increasing fear. We need to share accurate information about how the virus spreads. Speak out against negative behaviors, including negative statements on social media about groups of persons or exclusion of people who pose no risk from regular activities. Let's be cautious about the images that we share. Make sure they do not reinforce stereotypes. Let's not refer to people with the disease as COVID-19 cases, victims, COVID-19 families, or the deceased. They are people who have COVID-19, people who are being treated for COVID-19, or people who are recovering from COVID-19. And after recovering from COVID-19, their life will go on with their jobs, their families, and loved ones. It is important to separate a person from having an identity defined by COVID-19 in order to reduce stigma. Now, people who are affected by COVID-19 have not done anything wrong, and they deserve our support, our compassion, and kindness. Protect yourselves and be supportive to others. This has been Vivian's View. My name is Vivian Kai Lokko. Thank you for watching What the Papers Are Saying. Goodbye.